Fall is in full swing. Schools are full of kids and colds, and for families, fall means raking leaves, football, and maybe the flu. That's right, it's time of the year when stuffy heads and body aches are all around. With fall and winter respiratory season reaching from October through mid-May, it's less of a matter of if we experience symptoms than when. Pharmacist Ann-Lynn Safety joins us with tips on preparing our over-the-counter toolkit without throwing money down the drain. Good morning to you, Dr. Amy. Thank you so much for joining us. The first question is, what are some of the symptoms that we are seeing during this time and during this season?
Some of those symptoms include things like a stuffy nose or runny nose, headache, and not just feeling very tired and just not yourself. But if you have the flu, those symptoms are really intensified. So it's also coupled with a fever, body aches, cough. So you really can tell the difference if you do have a cold or the flu. So it's really important this time of year to make sure we're taking care of ourselves, getting enough sleep, eating right, and of course, staying hydrated.
And you suggest that we should all have a toolkit for cold and flu season at home. What should be in that toolkit?
Yes, definitely. So before we pack our toolkit for home, you want to take care of yourself from the inside out, and that's by getting your flu vaccine. So by getting your flu vaccine every year, it's the best way to keep both yourself and your family healthy. And it's recommended by the CDC for everyone ages 6 months and older. So that should be our first line of defense, definitely, for this flu season. And there's several products that I like to keep in my own medicine cabinet on hand, things like pain relievers and fever reducers, electrolytes, and nasal decongestants. That way, if I start to feel something coming on, I have something right there to help me feel better.
And if we have some of these items in our medicine cabinet already, should we be concerned about those expiration dates?
I definitely want to check the expiration dates. So expiration dates on medications, it's definitely different than expiration dates for things in your fridge. So when it comes to medications, when they're expired, it's not that they go bad per se, but they become less effective. So it's not going to necessarily hurt you to take expired medication, but it also might not help you. So when you're feeling bad, you want to make sure you're taking something that's actually going to get rid of the problem. So now's a good time to make sure you check those expiration dates and might need a little bit of a refresh for the medicine cabinet.
Good advice. Are there certain medicines that we should not mix together when we have a cold?
Yes, it's always a good idea to talk to your CVS pharmacist before buying something over the counter. That way we could check for any sort of drug interactions. But if you are taking certain medications for high blood pressure or certain antidepressants, there might be some over-the-counter combination products that might not be safe for you. So it's always a good idea to check with your pharmacist before buying anything.
And can the store brands be trusted as much as, some of the name brands? Like, how do we differentiate the two of those?
Yes, so the store brands go through the same FDA safety and efficacy testing as the leading national brand. So they are perfectly safe, they're effective, and they're going to save you some money. Something that's great with our new CVS branded items and the packaging, everything is very clean and crisp and easy to find what you need for the whole family. And also it's that time of year where we have FSA money. For most insurance plans might have to spend those FSA, HSA dollars, and a lot of these over-the-counter items are FSA eligible. So people who might need a refresh to get some fresh expiration dates in their medicine cabinet, now's a good time to go ahead and do that.
Great opportunities to save some money. Where can our audience go for more information about any of the things you mentioned here today?
If viewers want to learn more, they can visit